Hey guys, good evening. Happy Sunday. Hello, hello, hello. Do me a favor and confirm that you can hear me and that you can see my screen. And do me a favor and let me know if you let me know where you're watching from. Okay. If you are watching this as a replay, I know many of you guys don't catch me live. You're watching a replay. Just feel free to, fast forward the video to when we actually start. I know some of you guys have left in the comments that when you're watching a replay, sometimes you get distracted in the beginning as I'm going through the comments, but that's how we do it when we're live. So, if you're watching a replay, feel free to fast forward. To those of you that are watching live, hello. I'm so excited to go live this evening, guys. I'm just going to go over a few certification questions with you guys to help you guys get ready. So let me know as you're coming in what city and state you're watching from. Okay, I'm going to go ahead and take this off the screen and we're going to get ready to get started. Okay, so I see you guys coming in. Hey, Kelly. Hey, SMC from New York. Okay, guys, so I'm not going to, this is Sunday evening. I still need to get dinner together and all of it. I'm sure you guys got to get ready for the week. So this isn't going to be a long one. We're going to go through some questions together. For those of you, this is your first time here, how we do it, I'll show some questions on the screen and give you guys some time to put your answer in the chat, okay? So first of all, for those of you that don't know me, if this is your first time here, I am Kendra, aka Miss K. I've been an MA since 2004 and an MA instructor since 2011, okay? My first job is being a mommy. My daughter is 19 now. Also, I'm an author and entrepreneur. Okay. In addition to working as an MA instructor, you guys know I have my own business selling MA products as well. My biggest selling product is that MA customized necklace. You can put your name on it, and anything you want to find from me, you can find it in the description of the video for those of you that's watching on YouTube. Okay. So before we get into this exam prep, I'm going to go over some questions that I am always asked, okay? Almost every day I'm getting these questions. So one of the questions that I get, one of the most frequently asked questions I get is, will your old certification video still be helpful if I'm taking a new test? Now, there really isn't a new test, okay? The new test just meant that it was updated. You guys got to understand that certification exams, no matter what industry you're in, whether it's medical or whatever, certifications, they get updated just to make sure the information is still the same, right? Any new updates that came out, any lab work that may have updated, the numbers may be one or two numbers off now, different now. So yes, the old videos are still helpful for taking the updated tests, okay? And it is for all of the certifications, which leads to the next questions. Will your videos help with them taking an exam other than CCMA? Yes. All of the certification exams ask the same type of questions, guys. So yes, my videos are all for the CCMA, RMA, NCMA, whatever test you're taking, the certification, whatever certification you're taking, my videos help with all of them because they all ask the same type of questions. Now, I've already done videos on the differences between each certification, so you can check that out on my channel. It is called What is the Difference Between CCMA, RMA, etc. Okay. Another common question I get, what do I do if I failed the test the first time I took it, the first or second time? What you do is you want to look at your exam report, your score report, and you want to find out which areas you scored the lowest in, and you want to double down and study in those areas. Okay. Another thing I recommend doing is downloading the the test plan for the test you're taking. So for an example, if you're taking the RMA, you want to just simply go to Google and go to RMA test plan. You can download it. I recommend using the test plan to use it as a checklist. So everything you do know, you check it off. And then whatever you notice on the test plan you don't know, that's what you're going to go to your study material and find out once again. Okay. Yes, somebody said the videos from 2 to 3 years ago. Absolutely, yes. The videos from 2 to 3, even if there's something from 4 years ago, they are all still relevant because the information doesn't change. It just gets updated here and there, but they still ask the same kind of questions. Okay. Hey, Jacqueline, long time no see. Congratulations, Kelly. Can I get a job if I'm not certified? So this is going to depend on the company. Some companies will not hire you if you're not certified. Some companies will give you time. So some may say, well, we can bring you on, we'll give you 90 days to get certified, or 30 days or 60 days or whatever. So some jobs will bring you on. And then also there are some companies that will bring you on as entry level. For an example, the company I work for, they have MA1. So if you're not certified, they will bring you in as an MA1. And then once you get certified, you can get promoted to MA2. So it depends on the company. Again, some will not, some will. I recommend getting certified regardless, because as you guys probably heard me say, if you've been watching this channel for a while now, there have been so many people that I've helped get certified who have been MAs for years that never needed it, but now they do. Either the company all of a sudden started needing it because they got acquired by a bigger company, or maybe they changed jobs and that job needs it. So for whatever reason, they now need certification, and at first they didn't. So get certified. Study tips. That's another thing I am constantly asked about, are study tips. Now let's look at this next slide. Study tips. You guys can take a screenshot of this. Okay. You should be studying around the clock. Your life should be revolved around your study materials, your study guide itself, some practice questions. You want to network with other MAs, join MA Facebook groups. If you're on Facebook, I have one. It's called the Medical Assistant Lounge. When you're going through the practice test, I always say this: make sure you're paying attention to the wrong answers as well. As you guys are taking a practice test, if you have like the CCMA practice test, or RMA, or CMAA, or the CMA, it will give you the wrong answer and why. So you want to pay attention to those as well, because guess what? Those will probably be on the test too. Do not focus more on the practice questions than you do on the content. I've said this over and over and over for years. Pay attention to the content, not just trying to memorize the practice questions, okay? Also create flashcards, and you can have a family member quiz you. And then when you're taking the actual test, you want to pay attention to each question, recognizing keywords. Like, for an example, what do you do first? What do you do initially? Okay, what is the most important thing? Recognize keywords, and you want to use process of elimination. This is going to be big because you're going to see some answer choices that you know are absolutely not the answer, and you're going to use process of elimination to eliminate those answers. You're going to see some things. You're going to be like, oh, wow, I absolutely know this isn't an answer. You're going to eliminate it and work your way to the right answer. And lastly, for those of you that are about to take your test, make sure you are flagging or bookmarking the difficult questions, okay? Anything you have to sit and think about, flag those questions and run through all the easy questions first. That's going to be so important so that you won't run out of time. Answer anything you got to sit and think about, just go ahead and flag it or bookmark it, okay? Hey to my Instagram people as well. For those of you that's watching on Instagram, I hope you guys know that these videos do not stay up. There's no way for me to let it stay up. So if you want to rewatch this video again later, or maybe you catch me in the middle, you want to watch from the beginning, you got to watch it on YouTube. And do me a favor, guys, if my videos are helpful to you, do me a favor, go ahead and subscribe, and also like the video, like actually not the reaction options in the chat, but actually like the video, so that way that helps the video get pushed out to more people. Okay. And then one last thing I'll say about getting ready for as far as a study tip, you guys know I have my MA refresher course that is linked with this video as well. I'm going to talk about that a little bit later as we go through this through these study questions, but that is also an option if you want to be fully prepared. I have an online study guide. Okay. All right, let's get into it. Oop. Okay. Which quadrant is the appendix located? And which quadrant is the appendix located? Now, you will see questions like this where you need to know, when it comes to the abdominal area, which organ is in which quadrant. You guys know you got your right and left quadrants and your upper and lower. Which quadrant is the appendix located? And I just realized something. Hold on one second. I'm going to stop sharing my screen for one moment. Hold on. I need to fix something. Sorry, guys. I need to fix something really quickly. So I just stopped sharing. Continue to write in the comment section, guys, but I just realized I really I need to fix something and I don't want to keep sharing my screen. I don't want to keep sharing my screen. Hold on 1 second, guys. I'm coming right back. Okay. Let me bring this back up here and then let me share again. Oh, let me go back to StreamYard and share my screen again. Sorry, guys. That's what happens when we live. When I pre-record, I can edit this stuff out. But when we live, you guys, this is what happens. Let's see. Let me share that again. And then let me go back into present mode. Okay, so let's see. Are you guys putting the answers in the chat? Okay, so you guys putting the answers in the chat. Let me check on Instagram. All right, the appendix. Somebody said lower right quadrant, and you are right. So the right lower quadrant is where the appendix is located. So make sure you guys know where each of those organs in your abdominal area is located. Make sure you're familiar with the quadrants and which organ is in each quadrant. What's the third link in the chain of infection cycle? What is the third link? Okay, you guys know there's 5 links, and it was recently updated. There's 6 links now. Oh my goodness. But current testing material is still going with the 5 links. So what is the third link in the chain of infection cycle? It's the vehicle of transmission. Okay, so that first link is the reservoir host, right? The second link is the mode of exit. That is how it exits the body. Then you have the vehicle or mode of transmission. That is how it's transmitted to the next person. The mode of entry is how it enters the next person. And then that last link is the susceptible host. What are some examples of a viral infection? Examples of a viral infection. Somebody asked about externship tips. At the end, if you are still on here at the end, I will go over that. I want to focus on certification stuff now. I do have some videos on that. So if you guys have any questions about that, I do have videos. Actually, as a matter of fact, I have a whole playlist. I think it's called externship tips or something like that. Some examples of viral infections, that would be like your common cold, flu, HIV, herpes 1 and 2. So those are some examples of viral infections, okay? Which of the following blood pressure readings will be considered normal? Which of the following? Now, you'll notice as we're going through these questions, some of them I have open-ended, some of them will be multiple choice. The reason why I like open-ended is because, which leads me to another study tip. When you can answer open-ended questions, that's how you know you really know the information. So that's why lately the most recent study material videos I've done have been open-ended, so I can make sure you know the information. Now, some of these are going to be multiple choice because I do want you to see different options, and I want you to be, exposed to other things that might be on the test. When you have multiple practice questions, it helps you to see what else might be on the test. So which of these would be normal? If you said A, you are correct. 118/78. Now, let me just go back to this real quick so we can look at those. So 126/82 and 138/88, those would be considered pre-hypertension, okay? Because once that top number is over is between 120 and 139, and that bottom number is between 80 and 89, that's considered pre-hypertension, okay? So B would be B would be pre-hypertension, okay? And then actually C is going to be hypertension stage 1. I'm sorry. C is actually going to be hypertension stage 1 because of the 138, okay? 120 to 129 as a systolic pressure is pre-hypertension. 80 to 89 is is prehypertension. And then once you get over 130 to 139, that's stage 1. Okay. So B is actually going to be prehypertension, C is going to be stage 1, and then D is going to be stage 2. Okay, once you're over 140, that's going to be considered stage 2. Okay, 140 and above is stage 2. 90 and above is considered stage 2. Okay, next question. Which of the following is classified as a beta blocker? Is it going to be lisinopril, metoprolol, furosemide, or simvastatin? Beta blocker. Which one is a beta blocker? Okay, so it's going to be metoprolol. Okay. Hint, when you see metoprolol, atenolol, propranolol, when you see that olol, that right there, those are beta blockers. Okay, they reduce heart rate and they also reduce blood pressure. Okay, so it's going to be very important that you know your different examples of different medication classifications, and we'll talk about the other ones in a second, but we have another question that includes all of those, and then we'll talk about the others. Now we said metoprolol was a beta blocker. Which of the following is a vasodilator? Okay, which one is a vasodilator that actually lowers blood pressure by dilating? Oh, wait a minute. Oh, why I didn't realize. Okay, hold on, guys. Go ahead and put your answer in the chat. Hold on 1 second. I'm bringing up YouTube from my phone so I can make sure I can see. Let's see. I want to see all the messages popping up. Okay. All right. I see your answers coming in, guys. So vasodilator, which one is that going to be? That's going to be lisinopril. Okay. That's a blood pressure medicine as well. That a vasodilator lowers blood pressure. And then you may see vasoconstrictor. Vasoconstrictor, I don't have any questions in this specific study video on that, but that actually raises blood pressure. So lisinopril, we said, is a vasodilator. Metoprolol is a beta blocker. Remember the old laws. Furosemide, which is Lasix, that's going to be a diuretic. Okay, it helps to reduce fluid retention. And then simvastatin, I noticed a couple of people chose that. That is a cholesterol medication. That's another one to remember. Statins are cholesterol medicine. So you may see a atorvastatin, rosuvastatin, okay, pravastatin. Those are cholesterol reducing medications. All right. If a patient is prescribed 500 milligrams of a medication, okay, and then the stock supply is 250 milligrams, how many tablets should be given? So the patient is prescribed, the doctor ordered 500 milligrams. You go to the cabinet and you notice that the tablets are 250 milligrams. How many tablets should be given to the patient? They're doing firecrackers outside, guys. You may hear the sound out there. It is way after 4th of July, but this is what we get. If you're in the DC area, then you understand. They always out there doing firecrackers, fireworks, and all of that. So please forgive the noise in my background if you can hear it. All right, 2 tablets. Yeah. So what is the formula? What the doctor wants over what you have on hand. So D over H, desired dose divided by what you have on hand. So the patient will get 2 tablets. Okay. Now, just going back really quickly, if it was reversed, if the doctor had ordered 250 milligram tablets and you had 500, it would be 250 divided by 500 and you would get a half. You give the patient a half tablet. Okay. So Whatever the doctor ordered divided by what you had on hand. Okay, what's the correct angle for an intramuscular injection? What is the correct angle? Make sure you all know those angles for your injections. What is the correct angle for intramuscular injection? Yes, Love Foreign says 500 divided by 250 over on Instagram. She says, I think I get older. Oh yeah, Pril. Yeah, Pril, lisinopril, and there's another one. Prinville is another one. That's a blood pressure medicine, a vasodilator. But yeah, when you guys learn those suffixes like your OLAws and then your statins, that's going to really help you guys know, when you see them on your exam. All right, so your angle is going to be 90 degrees. For intramuscular, sub-Q is going to be 45 degrees. Now, if it's an insulin injection, that's the exception. So insulin, when you're giving sub-Q and it's an insulin injection, that can be given 90, but the sub-Q in general is 45. And then you have intradermal, which is 10 to 15. Which color tube top is used for a complete blood count? Make sure you know some sample tests when it comes to first of all, make sure you know the order of draw, okay? And then make sure you know some example tests. So in this case, we're talking about the complete blood count, the CBC. And make sure you know the additive for those tubes as well. Make sure you know the additives for those tubes as well. Okay, I see your answers coming in. Yep, that's going to be lavender EDTA. So again, make sure you know each tube, okay, and the order of draw. Make sure you know each tube and their additive, okay, and some common tests from those tubes. All right, a patient calls the office upset about a bill. What should the MA do first? Transfer the call to collections, calmly listen and acknowledge the concern, tell the patient to call their insurance company, place the call on hold until the manager is available. Now, when it comes to scenario questions, guys, when you see these, some questions you see is just going to be so just like common sense, super common sense, to the point where you're going to probably laugh at some of the questions, because you are going to come across some questions that's just going to be super easy. And you're going to be like, come on now. You are going to ask some questions like that. When you have some questions where you may see some options that can be, you may say, oh, wow, I see multiple options that the answer could be. And you go with the most professional answer, okay? What is the most, you go by the book, right? What would the most professional thing be, the nicest, the most patient-centered answer be? Always think about these scenario questions. Scenario questions are always patient-centered, okay? It's always about what is the best way to handle the patient, the best answer, okay? Most professional. And then this case is going to be calmly listen and acknowledge the concern, okay? Calmly listen. Now I'm gonna go back to this just so we can look at it, because as I mentioned, sometimes it can be a couple different answers. Now, if the patient is upset about a bill, in some cases you may have to transfer them to collections, because to find out exactly why the patient has the bill, because as an MA, we won't be able to tell them that, but the person that sent the bill will be. However, the most patient-centered answer and the very first thing we want to do is make sure we listen and acknowledge the concern. So even though, it could be that we will have to transfer them to collections or the billing department, not even necessarily collections, but even the billing department. But the first thing we want to do, and the most patient-centered thing we do, is calmly listen and acknowledge the concern. All right, so just a reminder, guys, I mentioned this early on. I told you guys I was going to show you some of this. My MA refresher course, the same way I'm teaching you guys during these study videos, I have slides with different lessons on there. I'm going over each body system. I'm going over, there's 12 modules altogether. We have anatomy and physiology, we have phlebotomy, we have EKG, all of that. So I'm just showing you guys an example here. In each of the lessons, I teach you guys a lesson. There are knowledge check questions for you to just kind of quiz yourself. And then there's a quiz and you get a score. And then, you know, you get a score at the end after each module. And then at the end, there are practice questions as well. So in the MA refresher course, it's an online study guide. There are over 400 plus practice questions that I made up, that I got from the test plans for the RMA, the CCMA. I use all of the test plans to create the study guide so I can make sure it is getting you guys ready. I got dosage calculations, and the goal is to make sure you guys are ready for any of the certifications that you will be taking. So you guys see an example here of how it looks when you're going through the practice questions as well as the modules. Okay, so that's at marefreshercourse.com. The clinical one is for anybody that's taking a clinical, like the RMA, the CCMA, the CMA AAMA. It includes both clinical and administrative. If you're only taking an administrative test, like the CMAA, then you get the administrative one, but you do not need both. Okay, let's get back into it. A patient leaves the clinic without signing a refusal of treatment form. What should the medical assistant do? Nothing, since the patient refused care. Call the patient back and insist they return. Document in the chart that the patient refused and left without signing, or discard the form. Which are you going to do? Which are you going to do? Nothing, call the patient back, document, or discard the form. Okay, I see the answers coming in. If you say C, document in the chart, you are correct. You're going to document that the patient refused and left without signing. That's all you can do at that point. You don't want to not do nothing, okay? And you want to document anything that happens with the patient. You want to always document. Documentation is so important, guys. It is, the medical record is a legal document. So, you know, if something ever happens and the patient decides to sue, let's just say the patient left and something happened to that patient, and they left without, they refused treatment, and they wouldn't even sign the form acknowledging that they're refusing treatment, right? Let's say something happens to them and they decide they want to sue because the doctor didn't do whatever. Well, now, because you have documented in the chart that the patient refused, you know, that is a legal document and it is binding. So that means that the patient can't say, oh, you know, nobody told me anything. Like, you literally documented right at that moment that the patient refused treatment and they refused to sign the form. Okay. Document. It's better to over document. I'm gonna be honest with you guys. I'm one of them people, I over document. I'll be honest. I will literally document every single thing the patient said. Even I had a conversation with a patient, and he was telling me that, you know, he had it was about a prescription refill or something, and he was telling me about something else. I documented that whole conversation. He was telling me about how he went out of town, and you know, he something I can't remember, but just know I document everything, because I don't even want to take a risk. What was it? He said something about, it was something that had to do why he didn't get the prescription or something, and he was on a bus or something, and something happened and some extra stuff. I just added all of that. You don't have to over document, but you definitely want to document. Which of the following terms mean doing no harm? Autonomy, non-maleficence, beneficence, or justice? Let me check on my Instagram, people. Doing no harm. Let me go back to YouTube on my. Okay, I see your answers coming in. Oh, did I not put the answer on? Oh, okay. I'm sorry, guys. I didn't skip one, but the answer, I saw you guys put putting the answers in. But if you chose non-maleficence, you are correct. I'm sorry, I don't have the slide that shows the answer. Autonomy refers to allowing patients to make their own decision, right? Beneficence refers to doing good, and then justice is equal treatment, treating patients equal and fair. And these terms refer to the principle of ethics. Okay, these are the principles of ethics: autonomy, non-maleficence, beneficence, and justice. Okay. Which schedule of controlled substances has the highest abuse potential but is accepted for medical use? Make sure you guys are familiar with each of those 5 schedules of drugs, okay? The 5 schedules of drugs. Which has the highest abuse potential but is accepted for medical use? Which has the highest abuse potential but is accepted for medical use? Okay, if you say Schedule 2, you are correct. So Schedule 1 has the highest potential. However, Schedule 1 drugs are considered non-acceptable for medical use. Okay, so that's like your heroin, and those are your hard drugs, right? Your street drugs as well. Marijuana is included in Schedule 1, even though marijuana is now accepted for medical use. It has not been updated yet, but that's probably something that they're working on, getting it moved to Schedule 2. But Schedule 2 is the highest potential that is accepted for medical use. Okay, then you got Schedule 3, 4, and 5. The higher you go up in schedule, as you get to Schedule 3, Schedule 4, and Schedule 5, they still have potential, but the higher you go up in schedule, the lower the risk of potential abuse. Okay, if a patient is prescribed amoxicillin, 875 milligrams PO BID for 10 days, how many tablets will be dispensed? So they have to take it PO BID for 10 days. Make sure you guys know those abbreviations, because this is how they will ask these type of questions on the test. Okay, so PO is what? BID is what? Make sure you know what those mean. PO BID for 10 days. How many tablets will be dispensed? Okay, so if you said 20 tablets, you're correct. PO just simply means by mouth, right? BID is what? Twice a day. So if the patient is taking it for 10 days, and they're taking it twice a day, they need 20 tablets. Okay, so twice a day, you just simply multiply 10 days times 2, and the patient needs 20 tablets. Okay, now if it was TID, which is 3 times a day, would have been 30 tablets. Okay, or QID, which is 4 times a day, it would have been 40. So make sure you guys know those abbreviations. Okay. What legal term refers to the failure to provide reasonable care? The legal term that refers to the failure to provide reasonable care. I'll give you guys a few moments to type that in. Yep. R.E. Gray 20 on Instagram. I'm just checking on you guys over here on Instagram. Yep, you're correct. It was 20. Yep, Tristan on Facebook. Twice a day for 10 days. Shout out to my Facebook people. Facebook now deletes live videos after 30 days. So if anybody is following me on Facebook and you're going to want to watch this later, it's only good for 30 days. And then you're going to have to just watch it on YouTube, because they don't keep videos no more than 30 days. Live videos, no more than 30 days anymore. Okay, so those of you that typed in negligence, you are correct. Failure to perform. That is a type of malpractice. Somebody put malpractice. That is a type of malpractice. Negligence is a type of malpractice, but specifically it is negligence. Which temperature site gives the most accurate reading for core body temperature? Which is the most accurate site? Not the most common site, but the most accurate. What is the most accurate site? Which temperature site gives us the most accurate body temperature? Okay, I see your answers coming in. So this is rectal, okay? Now see somebody put oral. Now oral is the most common, so you may see that question. The most common site is oral. The most accurate site is going to be rectal, okay? Which type of scheduling gives each patient a specific appointment time? Which type of scheduling gives each patient a specific appointment time? While you guys are typing that in, I need to go to my channel real quick and see what number this is. What number certification video is this? Let's see. Let me go to the playlist. I need to change the name of the playlist from CCMA to MA Cert. I think when I first started doing this, I was only focusing on CCMA, but I just want to make sure you guys know that it is for all of the certifications. Let's see, CCMA certification. This is video number 14, 15, 16, 17, 18, 19, 20. This is video 21. Okay. And if you chose stream, you are correct. So make sure you guys know those appointment types too, okay? Now, stream scheduling is also called time specific or fixed, okay? The way they might ask you about stream scheduling on the test, it may just say a patient is scheduled from 9:15 to 9:30, literally, and that's going to be stream, okay? You might say, well, that's just 9:15 to 9:30, yeah, and then you're going to be able to rule out the other ones anyway, because one option is going to say wave, and wave is, the patients, multiple patients are scheduled at the top of the hour and the rest of the hour is left open, okay? The modification to that, which is modified wave, is when maybe multiple patients are scheduled. Two patients may be scheduled at the top of the hour and another one is scheduled 20 minutes or 30 minutes later, okay? Double booking is two patients in the same time slot. Open hours, there's no appointments and patients are seen as they come in or according to their need. So you're going to be able to rule them out anyway, but that's why it's so important to know all of them. So if you see something that says 9:15 to 9:30 and you're like, wait a minute, that's not saying anything, it's stream because it's time specific, okay? They get a specific time, and the amount of time they get is depending on what they're coming in for. So if it's a follow-up, they may get just 15 minutes. Physicals may get 30. New patients may get 30 or, 45 minutes to an hour. That's your stream scheduling. It's time specific or fixed. Which artery is most commonly used for adult CPR pulse checks? Which artery is most used in emergency? So if you have to check your patient, victim's pulse, you notice somebody is unresponsive, which pulse site are you going to go for? Which artery are you going to go check? All right, if you chose carotid, yep, you're correct. Now radial is going to be the most common pulse site for an adult, right? And then of course you guys know brachial for babies, okay? But when it comes to emergencies, you want to go for the carotid artery. Which position is used for rectal temperature measurement and rectal exams? Which position? Make sure you guys know all of your positions as well. Make sure you know your positions. Somebody on Instagram said radius or carotid. You were correct with carotid, but radial is the where you check it on the wrist. That's the most commonly used for adults. I'm glad you caught it too. Somebody on Instagram said, I'm so glad I caught this before my NHA exam. I'm so glad you caught it too. If you are not already, follow me on YouTube. make sure you do so. I have a lot more videos. I just was counting. This is actually video number 21 of the certification playlist. If you put SIMS, you are correct. You're correct. Make sure you know your positions: lithotomy, dorsal recumbent, Trendelenburg, what else? Prone, supine, knee, chest. Make sure you guys are familiar with your positions, all of them, and what type of exams can be done in those positions. What is the proper ratio of compressions to breaths in adult CPR? What's the proper ratio of compressions to breaths in adult CPR? Somebody said prone. Yeah, for that last question, it wasn't prone. And you guys know prone is lying on your stomach, but it's going to be SIMS for easy access to the rectum. All right, I see your answers coming in. If you chose 30-2, you are correct. Okay, now 30-2 for an adult CPR, always, whether it's one rescuer or two. Now, according to AHA, with kids, though, with pediatrics, babies and children, it's 30-2 when it's one rescuer. However, when it's two rescuers, it's going to be 15-2. Okay, so adults always going to be 30-2, whether one or two rescuers. With kids, it's 30-2. With pediatrics, it's 30-2. But then when it's two rescuers, it's going to be 15-2. Okay. So make sure you guys make a note of that. If you've been certified in CPR, you probably already know that, but just make a note of that as well, if you haven't already. Okay, the absence of breathing. The absence of breathing. Is it dyspnea, apnea, orthopnea, or eupnea? The absence of breathing. Yep, I see you guys on Facebook. Let's see how my Instagram people doing. Congratulations, Mrs. Hopkins. And everybody else that have recently passed your test. Okay, yep. If you chose apnea, you're correct. You are correct. So dyspnea, y'all always say dyspnea because I'm looking at it with the two terms combined. But it's dyspnea. That's abnormal or difficulty breathing. Orthopnea is shortness of breath while lying down. And then eupnea is normal breathing. Okay, guys, so this is going to be it for now. Let me know if you have any questions below. I'll stay on for a few minutes. Just a reminder, if you want some more of this, I have it in my MA refresher course. It's an online study guide. It's only $27. It is going to be linked with this video. Matter of fact, let me put the link in the comments right now for anybody that needs it. In the meantime, I'm going to stay on here just for a few minutes. Let me know if you had any questions. For the person that had that question about externship, let me know if you are still here. Let me know if you are still here. Otherwise, if anybody has a question about it, you really can just look at I have a playlist on it, so you guys can check it out there. But let me know. I'm going to give it a few more minutes, see if any questions come up. I just put the link in the comment section. Let me put it on here on YouTube as well. Yes, MXXN on Instagram says, will this video be uploaded? Yes, on YouTube. Yeah. Do me a favor, guys, like the video if you guys on YouTube or Facebook, do me a favor, like the video. On YouTube, there's an option to react to it within the chat, but I meant like actually putting the thumbs up on the video. I see I have 19 likes. Thank you, guys. You guys have been liking the video. Do me a favor. Let's try to, how many people we got watching in the chat? We got 20. Can I get 20 more likes if you haven't already liked the video? I'm usually not that person on YouTube chasing likes, but I have had some type of shadow ban on my channel. My videos haven't been pushed out there. So that's why I'm asking you guys to like the YouTube video so it can be out in the algorithm where it's supposed to be. You're welcome, R.E. Gray. You are so welcome. Thank you. Would you have any recommendations on how to remember the draw colors and what each color suit? Oh, that's my main. So honestly, I don't have the only thing I have a trick for is remembering the order of draw, to be honest. And that trick is young boys really get great looking girls. I'm going to put that in there. Young boys really get great looking girls. Acronym for order of draw. Acronym for order of draw. The only thing I can recommend for remembering the test that goes with the tubes is just studying it. I don't really have a trick for remembering what it's used for except studying. The order draw, we got the acronym young for yellow, blood culture, boys for blue, light blue, really for red, get for gold / SST, get great looking green is great looking is lavender, girls is gray. So that's the only trick I have when it comes to the tubes is the order draw acronym. But as far as remembering, if any of you guys have any suggestions, feel free to leave it in the comments. If you have a suggestion for for remembering what they're used for, I don't have a trick. I'm sorry, guys. Let me know if any of you guys have a trick. Marilyn, I just posted it above, but I'll go ahead and post it again here. She asked for the link to the study guide. I just posted it again for anybody that's interested. I'm adding more to it. I added a component of the study guide where I'm going through the questions and explaining why they're incorrect. So I got to do more. So far, I've only done the first 2 or 3, but I'm adding it to the other modules as well, where I go through just like I do here and explaining why the answers are incorrect. Let me check Instagram, see if they got any questions. Okay, let me go back here. All right, guys, if that is it, if you guys don't have any questions, I'm going to get ready to get off here. Thank you guys for hanging with me on a Sunday evening. You're welcome, Sam. Sam says, thank you for going live. You are so welcome. I'm trying to get back into it. I'm working in the office during the day and teaching in the evening, so I don't have time like I used to, but I had some time today, so I just decided to go live. All right, let's see. No other questions. All right, guys. Y'all have a good evening. Have a great week as well.